that amount of savings is obviously a risk, and we've just got to, you know, be very careful in 26, 27 that we're not cutting it to the point where, you know, it's putting our residents at not in harm, but in, you know, it's impacting on the services they receive and how they can function and, you know, be supported well. The risk, I think, is noted in the report about costs of care for younger people. As mentioned in the meeting today, there's one provider rising their costs by up to 36%. And I think there's a real challenge to the council here at the moment around commissioning service and the procurement side of things. So a recommendation, I think, from this panel is a focus in on that, on the commissioning services and procurement, to ensure that, you know, any providers that we're using we're robust with them and that they do match with our neighbouring boroughs and that we're not having been charged significantly higher than other boroughs. A recommendation came from the panel today around cross-working with housing and children, and I think that came out in the conversations around connected communities and how that worked, but also about the localities team and how that's all going to join up with those budgets and with that sort of service offer. A recommendation around the savings around the change boards and looking at the tracker, that they're category A savings, so they're having close examination about the delivery, mitigations and tracking of those savings. And then obviously we're bringing the tracker back in December on both of those. And then there's a recommendation around the work being done to grow our own staff, and we're talking about that 5% reduction, the pressures in that across the whole of the council, but actually in adult social care, we were hearing about the agency staff. I think 25% of the workforce is agency staff, which was very significant, and that's, you know, quite a surprise to hear, but actually about the work that's been done. And I think Councillor Haran put forward, and I'm sure there'll be a much better summation of the recommendation, but the challenge on how we actually make sure that we can ask agency staff to come back and be, you know, full-time staff here, and the challenge is actually, are we achieving that? We've done the connected communities, yes, and we've done all the rest as we went through, so I won't re-go over them. So was there anything in the main report that I've missed that you just wanted to capture now? No. Okay, and the other recommendations we did as we went through. Otherwise, thank you very much to everyone who came in today, and we'll see some of you back in December for the savings tracker. So for that's our agenda. We've still got the work programme, so don't all rush off at once, but thank you very much to everyone for coming in today. Thank you. Right, work programme. Dominic. I think I've spoken enough.
So the main thing to make you aware of in relation to the work programme is we are going to have to make some changes to the December meeting. Obviously, we have just been speaking about having the savings tracker back, but we're also, if you see on the on your report there, the two items that we had planned was the quality assurance and CQC overview, and then also CQC inspection. Now, I've actually been informed this week that we understand the CQC inspection is not going to be ready for the 17th of December. So we are trying to arrange a agenda setting meeting to discuss that, but we do have a bit of a gap. The obvious issue to bring back is that we may have a second round of budget savings that we want to present to you, and obviously we have the savings tracker as well. So there are some obvious items that can fill that gap straight away. But we're working on that, and we'll obviously keep you informed. If there is any further gap and we need to bring another item in, then obviously we'll let you know.
So
what to say anyway, so
no, that's fantastic. So we've got the so we've actually got the quality assurance and CQC. So which one have we got? We've got the CQC.
Yeah, so the quality assurance CQC overview, that's the annual item. So the quality assurance item, that's the one we have every year, or we have in recent years. So that's still going ahead. It's the one about the major CQC inspection that happened recently that we understand that it's not going to be ready. But I'm trying to set up a meeting involving Councillor Connor to get that sorted out. And then in February, we've got the one that was suggested was the preparedness for a future pandemic. And then we've got cabinet member questions as well. So those are the...
Yes, you can. Can I just say very quickly, it might be worth us moving the preparedness for future pandemic into the December meeting, keeping the CQC yearly one and then holding the other space for budget, because obviously we've got the tracker, which is substantive. And then we may well have some further information, and then we've got a bit longer to work out what we want to do in February. But that's just a suggestion, and I'm very open to other thoughts. And the Councillor Brennan's coming in first on that.
So I was just going to say, going by just the conversations we just had, I'm really interested on, maybe it'll come back to us on the savings that were achieved in previous years, whether they've been achieved. Previous years, not the current ones. You know, were they achieved or were they not achieved? Do we get that? Do we get given those figures?
So not the ones that we saw tonight, but ones from years dating back behind.
Yeah,
that.
I'm not saying
Yeah.
it has to be at the next meeting. I'm just
Yeah.
saying I would like to actually investigate going back whether they always are achieved or what percentage are achieved, whether it's only 50%, 25%, 100%. I'm interested.
We will have those figures. I mean, I think from previous budget scrutiny reports, I mean, generally they're not always achieved, and then they're basically reconfigured, and then yeah. So we
Exactly what I think. Yeah.
Yeah. So I mean, we could compile them all from I don't know 3 or 5 years back, because they will be in the reports that we received. I mean, we might need some finance support on that, because that would be a little bit complicated to do, but it has all been in our packs. It's just that obviously we only see them 1 year at a time, and with a big gap between, so having them all in one place is something we haven't had before, I don't think.
No, I've seen them in the past and they haven't been achieved, which is why I was asking specifically, you know, when she thought they'd be achieved. I didn't think they were going to be totally achieved, but now I'm interested.
To be fair, in the past, we've used reserves. So when they haven't been achieved, we've always been able to draw down on reserves. So this is, I think, in the cabinet pack, it makes that. So I think that's, so that's kind of where we sort of knew they weren't being, but because reserves were being used, it sort of mitigated it in that respect. But I hear what you're saying, and yes, that's a piece of work that can definitely be done. It's just whether we want that as a full agenda or whether we want that in another format, just for information, might be helpful. So sorry, I think I saw Councillor Donovan had his hand up, and then Councillor May.
Okay, leading on for that, but actually slightly different. It's really related to next year. 25-26, obviously at the budget at the moment we're looking at the new savings, but there will be savings, as was outlined just now, that we may have, say for instance transitions, we may have agreed to a certain savings last year and then there'll be another savings next year and the year after, but it's really the savings that are coming up as part of that multi-year savings package, which will be for next year. So we can look at those we've obviously done the budget now, but we also need to look at what else is being saved, if you like, for next year. Does that make sense?
I wasn't quite following at the end of that. So
okay, let me just give you an example.
Yeah.
Okay, transitions. I think last year we agreed that in 24-25 there would be a reduction. Either it will be zero, I think, or there may be a reduction. But then we also agreed last year that there would be further savings 25, 26, 26, 27, 27, 28. So it's really the reductions that will be, or the savings that are next year, 25 26, that we've already agreed to, that we've got a little bit of information tonight, but we probably will need a little bit more, because they will be savings at the same time as making other savings just for that particular year, 26, 25, 26.
Yeah. So we will have originally when we agreed those, that we will have a more detailed report. I mean, sometimes we don't get as much information as we would like as tonight, but we will have the details of that savings, which I was saying we could bring those from the archives and then add those to what you've got here, so that you can actually see, yeah, the multi-year saving that was proposed. I think the thing that wasn't very clear about the last page here, the multi-year savings tracker, is I guess those were the proposed figures. There's no update on whether those are revised or whether those projections have been revised. I presume that what they've got here, and I think that's why we need to sort of, we'll have a discussion with them before the next meeting, is, you know, the figures they presented on the multi-year, is that what we originally provided with it? Have those been revised at all or adjusted because of their expectations have changed? That wasn't quite clear. So I don't know if that answers your question, but I think that was my understanding of it. But we should have more information, and we can ask for more information if that doesn't. Yeah.
Yeah. Sorry, Councillor Mason and then Councillor Curran. Oh,
Mine was as well.
yours. Oh, you both got suggestions. Okay.
Maybe a way of helping your suggestion is to see if it's possible to work out the very first time it was proposed for a particular saving on a particular tracker, for example, because they always do it for 3 to 5 years, to maybe to go back from the very, I don't know if it's too much work, but that way maybe you can get that in a more accurate, accurate measurement. Whether it's possible, I don't know, but that's the only way I can propose a solution to tracking accuracy or how whether we did make the savings that we proposed to start off with.
And I think that the individual savings used to, the format slightly changed. The individual savings used to have a specific code next to each one, so that you could go back and the savings tracker. We said in the meeting that the savings tracker relates to savings that were agreed last year. That's not necessarily true. They may have been agreed 2, 3, 4 years because they're multi-year. So the previous format, you'd actually have them almost in chunks by year, almost, when they originally were suggested. And now they've sort of been put all together. So I'm a little bit, because obviously there's quite a lot of savings here, and they can't have all been 1 year proposals. There's like,
I think
must be 20 there or something.
I think we're going to delegate the authority to Dominic to suggest we go back to the original, how we had it before, which is much clearer, and actually had the information against each of these areas, because otherwise we can't scrutinise them. I mean, we can't scrutinise something that just says adults and health panel against it, because I mean, we would have been there till midnight if we'd asked them to go into detail on each one of those. Councillor Mason.
Yeah, so what I'm interested in is what the impact, both financially and service-wise, is of a failure to reach a failure to avoid deficit on spend this year. So what happens if we can't use reserves and we have I don't know, £500,000 or £1 million overspend? What's going to happen to next year's budget? That's number one. And number two is, in next year's budget, what is going to be the impact of the reduction of these services? And I'm sorry, I don't sit with there is no impact. We haven't heard that, and I can't accept this level of cuts will have no impact. So what I want to know about the actual money, what happens if we don't meet our targets this year, which it looks like we mightn't. And secondly, what the impact will be on the 24-25 budget and the impact on service delivery.
Those are questions to have in December, which is why I took, why we've delayed this for December. So you're right, but those were the questions you're going to need to ask officers at that. I mean, they will come with that information as part of the tracker. Are you saying you want to put specific questions before we meet to the officers?
Yeah, I'm saying that I think we need to know, and we can't, if we ask that question in December, then it's going to be a bit late in terms of the budget for 25-26, isn't it? So I think we ought to know what the predicted overspend is on the budget we've asked that, I know, but what the impact that will have on the 25-26 budget, because that's the bit that we didn't ask for.
You're making a recommendation on what we've just discussed, and you're asking for that
a bit more for that to be carried forward. So what's going to happen in the following year?
Right. So the recommendation would then be from the panel to say that we've got concerns
Yeah.
if, firstly, those savings aren't achieved,
Yeah.
and secondly, what impact would that have on residents,
Yeah.
on service users, if that doesn't happen?
Yeah.
So you like that included as a recommendation? Right, okay, sorry, Mo, now I'm clear what you're asking
Sorry, I
for.
beg your
No,
pardon.
I thought you were asking
No,
for December.
My
Fine.
communication.
No, it's getting late and I'm just, yes,
agree.
I know.
Added. Can I just quickly, before Sean jumps in, can I just ask what's happened to the domestic abuse work that we did? I don't know if it has to come back to this committee or where it goes to, but we did a lot of work and I've never seen a report following.
Can we
that.
just go to Sean and Kathy
Sure.
first and then hold that because that's project stuff. Is this still on this part?
Well, it's linked to what we were talking about earlier, relate to the leisure centres and the well-being, the health and well-being, and how we can have an input into how membership is promoted, how we can identify people that we think should be exercising more and aren't, and the whole structure of memberships, etc. I'm not sure whether can we call Emily, Councillor Arkell, to have a discussion with us.
Just to say that I'm pretty sure OSC is, I know that Leicester asked for this to come back at the beginning of, so sort of February time to OSC. I'll check to see if that's still on the agenda. I'll check with Matt to make sure that's still on the agenda, but I'm pretty sure as a panel we agreed to look at leisure services and what's currently happening and any impact. So we could take those questions there, or we could have a separate agenda item ourselves where we look at the health strategy. So health strategy. Okay. What's the rest of the panel think? So that will be in February. But I will just check with OSC what we're covering, just to make sure we're not doing, Emily doesn't come here and then the 2 days later she comes to OSC and does exactly the same question. So I'll check. We'll check. I'm saying we, it'll be Dominic. Who am I kidding? Dominic will be checking. But yes, so, but if not, are we looking to do that in February?
Sorry, there's clearly a relationship between what you're asking for and the, no, I don't know what they called them, the action plans, the area plans. So can we integrate those two?
No, that's very, so localities team.
Locality, yeah.
So localities team will be a huge agenda item, and it won't, yeah, I wouldn't want to mix those two because
Okay.
one, that's a distinct, very scrutinised, very focused piece, which we could have in a larger agenda and actually have that as that third one to get that data. But the localities team is a much larger piece, I would
And
say.
also, do we really need Councillor Arkell? I mean, happy to come, but we're asking a simple question. What's the, to ask a question? It feels quite,
It's not going to be one question. I'm not having an agenda item with one
well,
question
no,
on
but
it.
I thought that what we were asking was to make sure that the new leisure services had were able to encourage people into their use and how they were going to do that.
I think we're looking, because as part of the bringing it back in-house, there was a big thing about having this new health strategy. So when we asked OSC about that, it hadn't actually been developed at that point, but it was going to be developed. Now, my understanding is that that now should have been developed because obviously, you know, it was predicated on that, you know, that it all came back in-house. So I think that's why the health thing is important. Yeah, I think there's a lot in there. We're going to keep it brief because time is, we need to get to 10 o'clock. We've got a 10 o'clock cut-off coming up. So
Okay, can I do my very quick question then? So part of this, so I was going through my mind the whole time when I looked at this tracker right from the beginning, I thought it doesn't look like they're going to make those achieve those savings. So I was worried about that from the beginning. And I think that part of it coming back in December, we should actually, I think it would help inform us if we had 1 year, just 1 year, so we could go about 1 year and actually see what savings were achieved, not achieved, just 1 year back, not loads of years back, but I'd just be interested to know, because that could inform our conversation. I'd just say, well, last year, 70% were achieved. Are you really saying that 100%? I mean, if we're going to scrutinise, we better be sort of like evil.
I just think thorough is probably a better way.
On the ball.
Tie.
I think for purposes of accuracy, if you look at the numbers, they have actually overachieved on the savings. So if you go back down, if you have a look at that, they have. Because
So it'll be good.
no, but it already tells you there. There was one big item where they saved much more than they anticipated. I think I looked at the screen. I think what I would like to see is the accuracy. I mean, how can all the numbers be 0 and 5 and 1, right? Or 2? I'm sorry, but that just, no, if you look at that, it's all there, right?
Yeah.
That
We've agreed with
cannot be
you.
right.
We've agreed.
Yeah, that cannot be right. You go and have a look at it, Kathy. It's there. It's all there.
So, yeah.
So, but I think the point to scrutinize historical savings is a good one.
Yep.
I mean, just through memory, I've done this now 3 years in a row. It takes about, no, I think what it says, the accuracy of this year, have a look. They have to, no, so, but,
Right.
but.
Chair, we've agreed it. So I've heard what you said, completely agree, and we're going to be doing it. Just very, very quickly, sorry, but we did have a coffee and catch up, and there was a conversation about how we move forward with projects. There was an agreement that Dominic mainly would be looking back at recommendations over the last 3 years to see from the projects if they have where they've got to and how far they've been agreed. Sheltered housing team is a little team set up if anyone else wants to join that team. Sean, do you want to just very briefly say what your cunning plan is with you, Sheila and Kathy?
I wasn't on the group, but it was a very 30 pages of your review, and you visited a number of sheltered housing, and there were a number of recommendations, and then there was the cabinet's response to those recommendations. So what we're looking at the moment, when I think myself and Kathy and Sheila hopefully will have a meeting in the next week or so, is looking at those and going through them and seeing which particular recommendations we want to highlight. We may want to ask, and then we will be. Sounds appropriate if we go back to the cabinet member and ask an update. But some of the responses weren't completely straightforward. That it was more this. We will do this if this happens, and etc. There was others that were a lot more straightforward, and there were some that the health service were dealing with. But yeah, but hopefully we will. I think it's good to work with sheltered housing because it's such a good clear review. And then I think the idea is then we go on to other recommendations and go through them and in the same sort of way and find out what's happening. And I think at some point we will be visiting the sheltered housing and finding out what's changed, what's worked, what hasn't worked, and I'm presumably making more recommendations after a meeting.
And a great task and finish group that is too. Just to be reassured, we are going to be looking at the wider ask from Scrutiny Cafe, and I think we had one suggestion that I put round to you all, what that was for a wider piece of work. At the moment, it's a bit difficult because officers are snowed under. We still need our report from the last one. Dominic is doing many jobs at the moment. So I think what we're going to do is concentrate. So you guys are doing the task and finish, and then Dominic and I look to how we can flesh out the other suggestions that I've put out to you as an email. Obviously, please email in if you've got anything else you want to add to that wider piece of work, but I can't see that happening immediately because I think we just need to make sure we've got officers doing what you know, the catch-up stuff first before we ask them to do the next set of projects. But anyway, so that's where we're at. Violence against women and girls,
And
that
that-
goes through.
Just very quickly about this is that housing scrutiny, I thought, did a really good thing, which the chair sent out to all councillors to ask if they had any feedback to give to their project they were looking at, and which is about housing associations, and it enabled us as local councillors to feed in. Can you please do that with this group as well, because a lot of us have got close relations with sheltered housing. Thank you.
Okay, well, I'll leave the scope to the three because I'm not micromanaging them. You guys are a little team, so yeah, that's absolutely fine. And with that, violence against women and girls is going through OSC. Remember, that's the project at OSC. The project doesn't sit here. So thank you ever so much. I'm closing the meeting, and I hope it's before 10 o'clock. Thank you very much. I've closed the meeting. Thanks, Helena. Thank you.